Hello, it's day 25 of my endometriosis diary, and I've got a bit of a stinking cold today, so excuse my snuffly voice and sniffs, which I'm going to do now. So this evening, Bez and I went to go and see Dr. T, the surgeon. It was my appointment came upon us, and I wanted to go and see her to discuss possible options for the future, and what she remembered about what the situation was with the inside with my insides, with the areas where the endometriosis was left, and the reasons that they didn't take all the endometriosis out when she did the operation. It transpires that she's not actually an endometriosis specialist. She's a specialist in hysterectomies, and I didn't know that at the time, actually, because I'd been referred to a endometriosis clinic as far as I understood, but yeah, it seems not. Either way, it was the right decision, and she was the right surgeon to do the hysterectomy, to perform that hysterectomy. And so she was telling me about the amount of scar tissue that is around my bowel on the left side, and she said that she left the cervix in the she didn't remove the cervix, because oftentimes when you have a hysterectomy you'll have your cervix removed as well, but she couldn't remove that because of the extent of the scar tissue around the area, and that it could cause more damage to my bowel. So I wanted to know, basically what my options were, and they are to be referred to a endometriosis specialist. So she's given me a couple of names of some specialists in England, or other options are to have the right ovary removed, so that then I'm put into a forced menopause and will probably have to go on HRT. Or could try the PROSTAP, which is an injection that you have that lasts for 3 months, and it basically puts you into a false menopause, and then you have to take HRT to kind of balance it out, but it's not without complications, and there's they don't know enough about it, really. They don't know enough about the condition and why it occurs to convince me to start messing around with the hormones in my body. So you can tell already I'm not up for the Prostap thing. I'm not going to do that. Not at this stage, anyway. Is that all the options? Or pain management, obviously. Managing the condition myself, and maybe getting a referral to a pain clinic to talk to somebody about how to manage pain. So it's a lot to think about. I've got an appointment to have an MRI, so that they can get a clearer idea of the amount of scar tissue that's in there. I mean, it doesn't actually show endo as far as I understand, but it does show scar tissue, and I have extended amounts of scar tissue, and also potentially some issues with my under my left ribs that I've talked about before, which could possibly be endo on my urethra. Is the bit that goes from your kidneys to your bladder. I don't think it's called urethra. Maybe it's called something else. But anyway, that it can there's possibility that there's endo on that, and it's causing inflammation in that area and causing discomfort. So the MRI would hopefully show that, and then the day after the MRI, I've got an appointment to go and have like a scan as well, like an ultrasound sort of thing, so that they can see if there's inflammation on any of my organs and if there's any issues in that area. Just to give myself and them more of an idea about what's going on in my body. So, you know, coming away from that, I'm thinking that probably, well, I'm going to monitor. I'm going to continue to monitor how I feel and use my various methods to manage pain that I already use now. My toolkit of of endo. Not cures, endo coping mechanisms and whatever, because I'm not massively convinced that further surgery is the answer, because it's not without complications. Dr. T explained because of the extent of the scarring in that area that, you know, there's a chance that it could cause problems, further problems, or different kinds of problems if I have that bit of bowel removed or anything like that, because it's not as simple as having a bit of bowel removed, because of the scar tissue and how the bowel is fused to the cervix and how the scar tissue is built up in that area. So it's not a simple procedure really. So I guess, yeah, it's a lot to think about. And this is just like, you know, obviously Bez and I have talked about it all. He was at the appointment as well, of course, and asking useful questions that I'd forgotten to ask and writing things down whilst I'm just there like, brr, what? Yeah, so it's a lot to process again. But I feel a bit more prepared for it this time because I know a lot more about endo now. Yeah, so it's back to the drawing board and just, I guess just continue to like I say, do the good things that I've been doing already and monitor it. If it gets really, really bad, then I might consider something different. But right now, it's have the MRI, have the scan, take the painkillers, do my exercise, you know, eat well, try and keep myself well, and manage as I am at the moment. So that's me. That's up to date. That's me up to date. So watch this space. We'll see if I might well be in a different headspace tomorrow after I've processed it all. Who can say? All right. Thanks for coming and watching me babbling on about this stuff again. If you've got any questions or anything, I don't know, ask. I don't know if I'll be able to answer them, but if there's anything that I haven't covered or that you're interested to know, then yeah, ask me and I'll see if I've got any answers. All right, I'll see you tomorrow. Bye.